everybody from anatomy class. My name is Rachel Rodriguez Cruz. This is April 24th and this is module 4 skeletal system video presentation. I'm going to be using some aids today, like the scar is an outline of like everything that we were asked in order for the video to be complete, and also 2 extra little cards with the name of the bones, just for assistance, and there's nothing in the back of them. And of course, our little buddy here, he is helping me study a lot, and it's very, very useful. So I thank the school for including it in the lab kit. That was very, very useful. So first is the main components of the skeletal system, and the skeletal system is composed of bones. The bones of the skeleton, the cartilage, ligaments, and other connective tissues that help stabilize the body and also interconnect bone. Its main function is to support our body's storage of minerals like calcium and lipids, and also blood cell production, among other many functions that it has. The classification of bones according to their shape, we have 7 classification. That's sutural, pneumatized, short, irregular, long, flat, and sesamoid. And then the next point here is the actual skeleton. The actual skeleton is formed by the skull, which we will be addressing later on today. Then we have the associated bones of the ossicles and hyoid, which the ossicles are embedded in the temporal bone, and the hyoid is supposed to be right here, like floating, but it did not come with this model. And we have the thoracic cage, which is basically this part that I'm holding, and that is composed of the sternum, which is right here, and then the ribs, which is 24 of them, to 12 pairs of ribs. And then we have the vertebral column, and then this is the vertebral column. We have 24 vertebrates, we have 7 cervical, 12 thoracic, and then 5 lumbar. And then lastly we have the sacrum, which is all of this form. And then at the very end of the sacrum we have the coccyx. So after that we have the discussion of the skull. And the skull, I would like to start first with the face. It's kind of like the hardest part for me to like memorize and describe and also remember the bones. So in the facts we have the maxillary bone, and we have a right and left maxilla bone. We have the palatine bones. The palatine bones, we can't see it from here, but if we open it and like we kind of like bend it, we can like see it at the back of our like the body's mouth. Then we have the nasal bones. The nasal bones are I don't know, I forget, but the nasal bones are basically here, so like right here on like the top of the nose. And then we have the inferior nasal. The inferior nasal cochlea is like conchlea is like right here inside. Like you can kind of like see a vertical line, like a vertical bone. So like that is that. And then we have the vomer. So the vomer is right here. It's like at the tip of the nose, kind of. And then I have here the zygomatic bone, which I like to call it like my cheekbones. So like they are right here. Then we have the lacrimal bones. The lacrimal bones are inside the eye socket, and that would be right here. If like like right here is the lacrimal bone. And then we have the mandible, and then the mandible is here, the part that I can move. This is whole bone is the mandible. I think I'm done with all of the face bones, and I would like to go to the cranial bones. I started with the occipital bone is right here on the back of the skull, and then we have the parietal bones, which are on the side. We have the temporal lobes, which are below the parietal bones, like right here, and like on the other side as well. And then we have the frontal bone, and parietal, frontal temporal, the phenoid bone, and I like to call that one bad winds. So it sends basically from here all the way into the other side, and if we like open the skull, we can see it inside as well. Like you can see like these bad winds. That is the phenoid bone. And then lastly we have the ethmoid bone. And the ethmoid bone is the one that is also inside the eye. It's not like we could only see it from there in this perspective, so it's kind of like next to the lacrimal bone. It's like I would like to call that. The last part of the skull that I would like to have pointed out is the associated bones. Like I said before, that would be the auditory ossicles, which are enclosed in the temporal bones, and the hyoid, which is floating bone, but it's not here, but it's supposed to be like right here hanging. And next we're gonna go to the appendicular skeleton, and this includes the pectoral and pelvic girdle, and which supports and attaches the upper and lower limbs into the trunk. So for the pectoral girdle, we have the clavicle and scapula. The clavicles are right here. We have two, and then we have also two scapulas, right and left. The other one is then the upper body limbs, and we have the humerus, we can see it right here. And then we have the radius, which goes, I like to call it like you have the radius, and then you can see it because of the thumb, like you can like make sure that's the radius. And then you have the ulna, and the ulna goes parallel with the pinky. And then we have the carpal bones, which are right here. We have the metacarpal bones, which are right here. And then lastly we have the phalanges, and that is the carpal bones, metacarpal, phalanges. Yep, that is the upper body limbs, including also the pelvic ridge, so like the pelvic bone. It's also part of it. And then we have the lower limbs, and the lower limbs starts with the femur. It's like this big bone, it's the biggest bone, longest bone in our body. Then we have the patella, which is like right here. We have the tibia, and then I like to say like the tibia is like the biggest T, so like the biggest bone in, like the second biggest bone in the lower limb. And then we have the fibula. Following them, we have the tarsal bones, and the tarsal bones are like basically like this set of bones right here, and it covers like this ones too. And then we have the metatarsals with like I have my finger on like them. like it's all of this, and then we have the phalanges, which are the ends of it. And then I didn't forget anything, so that's all of the bones of the skeletal system. And then the last point that we were asked to address was how this is important in like my clinical work. And as a PA, I would specialize in rheumatology, and the skeletal system is of extreme importance for me to know, because in order for me to diagnose and properly treat several conditions, I would have to know the skeletal system. And an example of this is patients that will come to the office with rheumatoid arthritis, which involves like inflammation of the joints, and a very common one is the knee joint. So I will have to know its anatomy in order for like me to like put injections, like intra-articular injections, or like take synovial fluid out. And also like for patients that have osteoporosis, I would have to know which bones are more prone to be brittle, and like due to the wear and tear of like our daily use. I'm sorry that it took a little bit longer than 10 minutes. Thank you so much for everything. These are my cards again, so here they are, and this one looks cute. Thank you, and have a wonderful day. Bye bye.